Welcome to our summit, National Doctors Day, a tribute to the torchbearers of our health. I'm Nutan Manohar, adjunct faculty, Indian Institute of Management, Kozhikode, and the founder of Me Met Me. National Doctors Day is a significant observance day in India that commemorates the birth anniversary of Dr. Bidhan Chandra Roy, a visionary physician and statesman. Celebrated on the 1st of July each year, this day serves as a tribute to the tireless efforts and immense contributions of doctors to the well-being of the society at large. This occasion honors and appreciates the dedication, compassion, expertise, and immeasurable significance of these noble healthcare professionals who selflessly serve the nation for the betterment of humanity. The noble profession of doctors has its own set of challenges, particularly when it comes to them staying healthy. Doctors face demanding work schedules, long hours, intense emotional and mental stress. The pressure to provide optimal care, make critical decisions, and juggle multiple roles can take a toll on their own well-being. Additional exposure to infectious diseases, physical strain from performing procedures, and the constant need to stay updated with medical advancements adds to the challenge. So it's crucial for doctors to prioritize self-care, seek support from colleagues and loved ones, and practice mindfulness to maintain their own health and resilience. In the session of our Doctors' Day Summit titled Staying Healthy While Healing Others, Challenges of a Doctor, we have a distinguished panel of physicians who will deliberate on how they keep themselves healthy amidst their professional hazards. For this session, we have with us Dr. Ishwar Gilada. Dr. Gilada is the first person to raise the alarm against AIDS in India in 1985 and to start India's first AIDS clinic in 1986 and at the government-run JJ Hospital, Mumbai. Dr. Ishwar Gilada is a globally acclaimed HIV expert credited with bringing India on the AIDS control map of the world. He is the President, AIDS Society of India, ASI, and the Secretary General, People's Health Organization, India, and Governing Council member of the International AIDS Society. To tackle medico-social problems of the downtrodden, he established PHO, the premier NGO that spearheaded India's HIV awareness campaign. To date, he has addressed over 3,700 meetings and training programs in India and in several high HIV-burdened African nations. He has 82 awards to his credit. The Junior Chamber International USA conferred on him the Outstanding Young Person of the World award at Glasgow in 1995. He received the coveted Anne Mary Madison International Award in Munich and was termed the Indian machine gun against AIDS in 1999. He had taken up the issue of providing honorable last rites for COVID-19 corpses and preventing discrimination against COVID-19 patients. We have with us Dr. Tarlochan Singh Kler. Dr. Kler got his medical training from India, UK, USA, and was one of the founding cardiologists at the famous Escorts Heart Institute, New Delhi. He's one of the pioneers in cardiac electrophysiology and interventional cardiology. He had set up the first dedicated department for electrophysiology in India at Escorts in 1993. Dr. Kler introduced many new medical technologies in India and SAARC countries. He implemented the first ICD in 1995, first CRTP in 2000, and CRTD in 2002 in India, and also did the first conduction system pacing in 2015. He has more than 150 scientific publications in national and international journals in his name. He's received many awards like IMA Lifetime Award, TMA Centenary Award, Great Son of India Award, Legend in Medicine Award, Revered Teacher in Cardiology Award, and above all Padma Bhushan by Government of India in 2005. We have with us Dr. Harish Shetty. Dr. Shetty is the president of My Home India, integrating India to the Northeast. He is the governing board member of the National Testing Agency, also conducts mental health workshops in schools every week. Dr. Shetty runs suicide prevention workshop in mohallas and educational institutions. He works with NGOs to build wellness and mental health capacity, conducts a supporting group for those who have lost loved ones to COVID. He has often provided psychosocial relief, evaluated the disaster relief work, assisted building mental health systems for schools, colleges, NGOs, counseling centers, and mental health agencies. We also have with us Dr. Duru Shah. Dr. Duru Shah is the director of Gynaecworld, the Center for Women's Health and Fertility in Mumbai. She is the founder president of the PCOS Society India, beside being a member of the executive board of Asia Pacific Initiative on Reproduction. She is also the chair of the Council of Affiliated Menopause Societies, IMS, and the chair of Metropolis Foundation. She is a member of the board of Asia Pacific Initiative on Reproduction. She is also the member of the Women's Health Vertical of C20 India. Dr. Shah has been the proud recipient of many orations, awards, and honors, the most prominent being the FIGO Distinguished Merit Award, being the first and only Indian recipient of the prestigious award, and has been conferred the honorary fellowship of Royal College of Obstetrics and Gynecology. We also have with us Dr. Anurag Aggarwal. He is currently working as Director HOD Joints Replacement Sports Medicine in Marengo Asia Hospitals, Faridabad. He worked as the HOD Senior Consultant Joints Replacement Sports Medicine in Metro Heart Institute with Multi-Specialty Hospital, Faridabad. He also worked as Senior Consultant Joints Replacement Sports Medicine in Fortis Escorts Hospital, Faridabad, also at various other positions and hospitals. He was a recipient of the UP Chapter Exchange Fellowship Award in October 2004. He has various publications to his name. It's truly an honor and a delight to have each one of you here. My very first question is to Dr. Ishwar. Gilada. Dr. Gilada, what are some of the primary health challenges faced by doctors treating infectious diseases?
You see, when we are doctors, we also have a professional hazard. And one of the professional hazard is you picking up this infection by caring patients. And we do get drug-resistant tuberculosis, MDR, or multi-drug-resistant tuberculosis. We catch those infections which are respiratory-borne infections, including COVID. You must have noticed that during the COVID pandemic, with 2 or 3 different estimates, we lost 1,000 to 2,000 doctors in India. They died of COVID by caring patients. So, and during that period also, we were knowing that we are having that kind of hazard, should we work or not? And we took a conscious decision that you are sitting in a pilot's cabin and you think that you can die of an air crash. You cannot be pilot. You cannot be driver if you think of any kind of accident. So similarly, you cannot be a doctor. If you think of any kind of infection, you pick up as a professional hazard. What happens as in any other profession is that any other medical profession, doctors are called Shaitan. As soon as COVID comes, doctors are called Bhagwan. As soon as COVID goes again, they are called Shaitan. But they don't understand that we are also insan. So when people gain something, they will say you are God, you are next to God. If they lose something, we are always blamed. And in infection disease also we are blamed like that. But we make our conscious effort to see that we soothe our patient. We try to limit the infections in the patient, from one patient to another patient, from one patient to medical staff. And we try to do all sorts of those things to prevent infections in our profession.
Thank you, Dr. Gilada. Dr. Kler, what are some of the common health challenges faced by cardiologists due to the nature of their work and the demands of the profession? Dr. Kler, you are on mute, so if you could unmute yourself. Dr. Kler, you are muted, so could you unmute yourself? Doctor, if you look at the bottom of the...
Yeah, okay. Sorry. First of all, I said I want to really thank and congratulate Times of India to bring out this program, because at least it gave me a feeling that at least somebody is thinking about doctors in India. Now the challenges faced by cardiologists are not very different from other specialties. In cardiology, the only additional stress is that it is it is many times it's an urgent situation. It's a touch and go situation. So the cardiologists have to be really at their always ready to deal with the emergencies, because we get so many emergencies like acute heart attack, rhythm problems, cardiac arrest, and that puts additional burden on them. Of course, the stress of doctors, it's very difficult. If the public doesn't understand, that how much stress the doctors go through. If a patient dies, a doctor dies 10 times the same day. They don't realize that how much is the stress. I know, when a patient lies on my table, and I know that he can die because of complications, which the patient's relation never understand. They'll ask me, sir, what is the risk of this surgery? So I tell them, this patient has very low ejection fraction, the heart is weak, he's got diabetes, he has kidney problem, so he is a high risk, and the chance of mortality are 5% or so. And I even go to the extent of telling them in Hindi कि आपका patient मर सकता है, because they don't understand mortality. So then listening to all this story, they will ultimately, many of the North Indian patients will say, कि डॉक्टर साहब कोई घबराने वाली बात तो नहीं है. I don't know what it means to me, because they really don't realize whatever we tell to them. And if something goes wrong, then ultimately they blame the doctors.
I understand that, sir. Thank you so much, Dr. Chair. Dr. Shetty, what are some of the common mental health challenges that psychiatrists themselves face as a result of the profession and nature of your work?
We are only 9,000 in the country with 20 crore patients. Some of the most important consequences: burnout, exhaustion, tiredness, anxiety, and even depression. But having said that, I would like to share a fact which people do not know. 80% of our patients recover. And there's a lot of joy when you see those 80% of patients who have recovered, who are regular with their medications, who come on appointments. So there's a lot of cheer when they come with gratitude. There's a lot of cheer when we share humor. And so it is not all bad. As people say, इतना सुबह से शाम तक सुन के आप थकने जाते हैं क्या? But उन्हें पता नहीं कि 80% of patients who have recovered spread cheer, spread joy. And that is something very, very good. What is also important is those psychiatrists who talk to their friends after every 5 patients do much better. Those psychiatrists who do 1 minute of meditation, 1 minute of pranayam in between, they do much better. Those psychiatrists who say no to some patients who do not recover, they do much better. Those psychiatrists who don't think that the entire earth is on their shoulders, like Hercules, they do much better. So all in all, it's 20 crore patients and 6,000 psychiatrists. But those who take it in the stride and look at very, very, very innovative, small interventions within the day, they really do much better. Exhaustion, burnout, anxiety, and depression are some of the most famous consequences. But what people don't know is 80% recover, there's optimism in mental illness, and they spread cheer and gratitude.
Thank you, Dr. Harish. While I think the message that is coming out is that doctors are doing their best to take care of the patients. It is good to consider them as human beings, and you have already suggested an intervention of a single minute after a few hours. That itself can make a difference. So thank you so much, Dr. Harish, for that. With that, the question is to Dr. Duru. Dr. Duru, what are some of the specific physical health challenges that gynecologists face due to the nature of your work, especially because during surgeries there is prolonged standing and there is patient examinations, etc., that require prolonged standing?
Thank you very much for having invited me, first of all. I think the gynecologist, it's more emotional rather than physical. Physical, yes, when you're called in the middle of a night for a delivery. And women are very smart. They finish their work at home, they cook for their children, they cook for the husband, they take care of everything. They're still already in pain. And then they walk into the hospital ready to deliver. And usually it's in the middle of the night. This is because they're taking care of their families and companies. It affects you initially. You're enthusiastic, you're young, and happy to go and help out women who are in labor. But I think more than the physical is the emotional, which is more difficult. It's women who are having infertility, having difficulty conceiving, who are desperate, who have so many issues, so many problems with family, with husband, with in-laws, with everyone, that it sort of hits you. It hits you because you want to do so much for them, and sometimes they cannot afford it. Sometimes they can afford it, but it's not possible for them to get pregnant in spite of all the advances in reproductive technology. So we have got a lot of situations where we are very happy because when a woman conceives after fertility treatment, she delivers. So much cheer, so much happiness in the clinic, everyone's happy. But when she gets a negative test or when she's had some miscarriages, when she's had losses, it's quite difficult. So I think we need to be very empathetic as gynecologists, as women who treat women. I think we understand what they go through. And I think physical is definitely there. It affects your family life because you're running away anytime. Your children need you, but you're running away to attend to somebody else's child or to somebody else's wife. So it is difficult, yes, but we've all gone through it. And I think at the end of it, if somebody asks me, would you want to be a gynecologist again? I'll say yes, because it's a very happy state of mind treating women who have so many problems and we are able to solve them.
Thank you, Dr. Duru. Dr. Anurag, what physical health challenges do orthopedic surgeons face, commonly due to, again, the demanding nature of your work, especially the long hours of standing in operating rooms and performing physically intensive procedures?
First of all, thank you for inviting me on this platform. And orthopedic surgeons are having so much of the problems while doing the long surgeries. First of all is the varicose veins. Most of the surgeons are facing these problems of varicose veins. Second is that when we are operating, we sometimes have the low back pain, cervical pains, and while doing the continuous Bhushan and the sternus activities, we are also having the shoulder problems, sometimes tennis elbows, carpal tunnel syndromes. We are facing all these problems regularly, and many orthopedic surgeons are facing these problems. So,
thank you. Doctor, would you like to continue the answer? Okay. Thank you, Dr. Anurag. I think there is a common message that is coming out about how much of satisfaction is obtained by seeing the physical and mental recovery of patients, but at the same time there is a concern about the amount of physical and mental challenges that doctors themselves face. At this point, Dr. Ishwar Gilada, how do you as an HIV specialist manage the physical and mental strain associated with treating contagious patients?
See, nowadays HIV has become a very easy disease to manage, and we call it is better than diabetes. But we started working from the era where there was no treatment available, and when the treatment became available, it was so expensive that only 2% of our Indian patients could afford, and by stretching their limit, another 3% could afford by borrowing money from others. And that was such a frustration that medicine is available, but our patient cannot be given that medicine. And we fought a lot, leaving away the role of doctors, doing activism. And today, 92% of the world's HIV positive people are taking Indian medicine. That gives so much solace. Now, talking about when you get stress or strain, the best thing is not to go in role play. Sometimes Dr. Harish Shetty will be able to explain better that we, as a doctor, we go in role play. Now we see currently, after the section 377 is repealed, there are so many MSM, male sex with male people are coming. So many bisexuals are coming, which were not coming earlier. It doesn't mean that it has increased, but they're coming out. So when you go in role play, you think that, it can be in your family, it can be your brother, sister, it can be your extended family. So then you get more strength. And secondly, if at all you get strength, there is always Dr. Harish Shetty, a call away, you call him, he will counsel you, he will treat you. Of course, doctor treatments are always free. So that kind of stress and stress mechanism we take care of. And falling back on family, there are doctors who would work from morning till late night, and there are doctors like me who will work like 8 hours, like in a government service. And after that, we are with family. Before that, we are in family, having children, grandchildren around. I think that is the best stress buster anybody could have.
Thank you, Dr. Gilada. I think you are resonating with the various findings on human longevity as to, spending time with your family can be one of the best antidotes. Thank you so much there. Dr. Kler, how do you manage your own cardiovascular health while dealing with the stress and long hours associated with job, and especially when cardiovascular diseases seem to be connected to lifestyle choices?
Right. First of all, I just want to share some data which was published very recently in Economic Times. IMA did a study. A lot of doctors were interviewed, and the result of those data is that 82% of the doctors they they had a fear in performing their duties, and 56% of the doctors couldn't get enough sleep, which is 6 to 7 hours, and almost 14% of the doctors they fear prosecution, which is in their mind. Around 46.3% people had a fear of violence from the patient and their relations, and it's a pity that 57.7% of the doctors they felt that they should have a security in performing their duties. So that is a pity and the sad state of affairs in our country, I think, which we need to really give some kind of consideration. This is duty of the government, duty of the society, duty of the press to work in that direction. So now coming to my own story, how do I get stressed out? See, the thing is, I have learned one thing in life, that I love medicine, I love my cardiology. I will again after death want to become a cardiologist, and the happiness and the satisfaction which you get from a smiling face of a patient when he is being discharged after a cardiac care is immense. That no power, no money, no kind of reward can compensate that. So I'm very happy that I'm a cardiologist. But how do I keep myself? I do regular exercise. I am an exercise freak. I do 2 hours of exercise, cycle 30 kilometers a day, or I walk 10 kilometers. And I use rationality of my mind. I'm fearless. I don't care. I'm not feared of violence. I'm not feared of that somebody will arrest me, some police or IAS officer, any politician. I'm totally fearless, because I perform my duties with the best of my capability and honesty, so I don't care about anybody. So I am a relaxed man. To be honest with you, I have no tension in performing my duties.
You are my new hero, sir. Thank you so much for sharing that. Dr. Harish Shetty, how do you navigate the emotional toll of working with patients, and as Dr. Ishwar suggested, even doctors who have complex and often distressing mental health conditions?
1 hour of exercise in the morning, 4 to 5 days a week. Yoga or Vipassana. I would say that Maharishi Patanjali and Gautam Buddha were the world's greatest mental health professionals, and that's number one. But still, there are good days and bad days. Apart from that, safety net of friends, where you can be emotionally nude. You can always say, I'm shit scared, I'm angry. You can be emotional, you can be yourself. And that is something which I have, and that really works. Being with loved ones is something which is very, very important. And small joys inside the family really helps me to feel better. But the most important thing is, from the day I started my practice, I said I will not be a patient-based psychiatrist, but I'll be a people-based psychiatrist. So in the last 30 years, 35 years, once a week I'm in a school, talking to young children, talking to teachers, non-teaching staff and others. And they always come and tell me, the principal, you're doing great work in school. I said, no, I come for my relaxation. And when the 10th standard kids shout and laugh and cry, when teachers laugh and share, and so that milieu is a healing milieu. So being a people-based psychiatrist is more important than being a patient-based psychiatrist, because if you see patients all across the day, you're bound to be very well. But when you go and see normal people laughing and smiling, that's one of the most important ways I really relax myself. But let me admit, there are bad days, very bad days also. In fact, when there is suicide among your patients, that's one of the worst days for a psychiatrist. When somebody is very violent, it's one of the worst days. So those days, pray to God, believe that this will too pass, and keep in touch with your friends. And even if you don't sleep, be in touch with your friends, your family, and your colleagues. Your colleagues are extremely important in the entire process. So good days, bad days, increase the good days and try and minimize and shrink the bad days. People-based psychiatrist rather than patient-based psychiatrist.
Thank you, Dr. Harish. Often patients think that if somebody is a doctor, that they should never fall ill. That is such a, pressurizing fallacy to be had. And
lastly, one line. Whenever I'm in no mood, I tell the patient that I'm in no mood. You have to come to me tomorrow or day after. And they're surprised. And they say, Aapka bhi? I said, I'm a human being. All at sea sometimes. So I may not be able to see you today, you might have to come after a week. That works. And that is very important, to be very honest. We are human beings first and doctors next.
Thank you, Dr. Harish. Yes, we are human beings first and doctors next. And when it comes to being a doctor, I can see how much of passion and dedication each one of you put into your profession. Thank you, sir, Dr. Harish. Dr. Duru, what self-care practices do you follow to keep yourself healthy and radiant?
Yeah, I too exercise 6 days a week, every morning between 6:30 and 7:30. Before that, I'm up by 4:30, working on my academics, lectures, which I deliver all over the world. Reading, writing, there's a lot to be done, answering mails. And then, of course, spending a little time with my husband, because both my girls have grown up, both are married, both in their own homes, not in the country. And so an hour with my husband, reading the newspaper, over coffee, etc. And then, of course, going to the clinic after 9:30 in the morning and coming back at about 8 in the evening. I work mornings with patients and IVF patients, and fertility patients, and surgeries, and in the afternoons between 4 and 8 with my clinic, where I meet lots of women. And in the afternoons, I'm busy with meetings, and I'm on various boards, so a whole lot of meetings, etc. It's a very, very packed day. At the end of the day, I'm done. I'm in bed by 10:30, up at 4:30. So that's my day. Sunday is total relaxation. I prefer not to do anything. But yes, self-care, I think what really helps me in my mental health in terms of what keeps me going, that I've been always focused on, what can I do for others, which I feel is necessary to be done. Say, for example, when I was working as the president of the National Association of Gynaecologists, I worked for about almost 10 years trying to talk to the young people, because nobody at that time, this I'm talking about between 2000 and 2010, there was no information on puberty, no information on reproduction, no information on sexual health. There was no internet for people to, now everyone's on trying to get information, but which is not correct information. So we were going to schools, talking to the kids, talking to more than 8 million kids all over the country. And we managed to get adolescent reproductive sexual health into the curriculum of schools. This is what I spoke to the government, and I said, this is what we need to do. And how long can we keep going to schools and talking to kids? So it was taken up as part of the curriculum. So in short, at the end of it, it's so what you say, you feel so happy that whatever efforts you've put in has managed to take care of the millions of young people in the country. And this is what I've done all my life. I've worked on 4 different problems, issues which affect women in different parts of their reproductive age or even in their menopausal age, and managed to get things done for them at the government level. So I prefer to work in public health, make an example of what I do, take it to the government, and then get passed, that it becomes part of daily care for those women in different age groups. There are quite a few things I could talk about, but I think we need to go to the next person. So I think this is how I enjoy my life. Of course, when I'm with the family, it's 2 family vacations together. It's great fun, grandchildren, daughters, sons-in-law, and everyone together. It's great.
Thank you, Dr. Duru. You brought in this very important point of purpose. So somehow it seems like your relaxation comes from pursuing your purpose even further, which is working more hours. But thank you so much for sharing all that information about your personal life and work. Dr. Anurag Aggarwal, how do you prioritize your own musculoskeletal health and prevent occupational injuries? You had mentioned about shoulder and back injuries in your profession. So considering repetitive motions and physically strenuous activities that you're involved with, how do you take care of yourself?
Like others, I do exercise daily, and I also do yoga also. And I never miss walking in the morning. And I have also made a point that I have made the friends with me, and they are non-medicos friends, so that I can discuss, I can talk to them, and there are no hospital talks there. So no stress related from the hospital, and there is a fun. There is a fun also talking to them. Different topics are there. So I think that is a very good thing that helped me a lot. And then in the hospital I always try to remain active all the time. I use the stairs for going upstairs, and in the OT for preventing this back pains and the cervical pains, I follow the ergonomics principle. Like I will keep the OT table and the patient very near to me, around 5 to 6 centimeters near to me. Whenever you put the patient a little far off, there is always a risk of developing the back pains and the cervical pains. And also, when I do the arthroscopy procedures, I try to sit on the stool and try to do the arthroscopy, but I will maintain the level of the stool and the OT table properly so that I don't get the cervical pain or the shoulder pain. And also, I always believe in the teamwork. Whenever we do the long surgeries, and if there are too much of repetitive motions, then I will do the main work, and I will also allow my assistant, he will do the work for me. That is for the two purposes. First thing, I will relax myself. Second thing, he also want to learn, he also want to do the things. If he don't do, he will go away and he will not become a successful doctor. So that things I am following in the OT, and with the help of these things, I am doing for preventing the occupational injuries.
Thank you, Dr. Anurag. I mean, you have brought in some important points such as delegating work so that you can actually take care of yourself. And each one of you has spoken about the importance of physical exercise and practices such as yoga, pranayama, meditation to help build mental resilience, etc. So thank you so much for that. Dr. Gilada, what are the specific risks and precautions infectious disease doctors need to consider to protect their own health while dealing with infectious pathogens?
See, firstly, we need to decide what is a legitimate infection risk and what is not. There are some infections which can be transmitted very, very easily. There you need to protect yourself using mask, particularly when any respiratory diseases person comes, TB patient comes, MDR TB patient comes. Sanitizing stethoscope, it doesn't take much time, less than 10 or 20 seconds. Sanitizing stethoscope, sanitizing your bed, where if you have done any internal examination, using gloves when it is required. But sometimes the risk is not there, and it is a lot of myths spread about, say, for HIV. So I always, because people are not bothered about risk of smoking, risk of tobacco, risk of alcohol, but they are just having a HIV positive person at home, they are scared. So I tell them that for 37 years I'm carrying HIV positive people, I'm still HIV negative. So you do not get HIV like that. So we need to make that myths and misconception separate and the real risk separate. I'll give you another example. There was one time when we were running mobile clinic in the red light area. So one day driver told us that there was one very serious sex worker and she has been transported in our ambulance or mobile clinic to the hospital. So we had an administrative officer who was a retired IS officer. Hardly he knew anything. He said, all the staff go home, get the ambulance washed, and today is holiday. So I said, Aapne kyun kiya? Why did you do that? He said, she was a sex worker, HIV, she must be HIV positive, HIV may have come in the van, it will go everywhere. So these are all myths and misconceptions we need to tackle. Before working in HIV, I was working in leprosy. One day morning, I saw a leprosy patient who was mayus, he was unhappy. I asked him, what happened, Baba? So he said, एक कोई junior doctor आया था और उसने examine नहीं किया, ऐसा sister ने बोला, nurse ने बोला. So what he said in Urdu mixed Hindi, किस्मत की बदनसीबी है, सयाद क्या करेगा? Because of my bad fate, I got this disease. किस्मत की बदनसीबी है, सयाद क्या करेगा? हकीम है बेदर्द तो फिरियाद क्या करेगा? So doctor has to be passionate. He has to be compassionate. So if doctor doesn't listen to patient doesn't touch the patient, doesn't hug the patient, doesn't put a pat on the patient, I think that is the worst thing to do with the patient. So we need to decide what is contagion, what contagion can give you, and what contagion can give the patient in a better treatment.
Thank you, Dr. Gilada. Very clearly, you continue to be the machine gun against, the myths and fallacies that are connected to infectious diseases. So thank you so much, Dr. Gilada. Dr. Kler, what are the specific physical and ergonomic challenges that you encounter while performing procedures and surgeries? And how do you address these ergonomic challenges?
Now, see, before I answer this question, I want to tell everybody here that one of the reason of extra stress and burnout in doctors is that many of us, they work as individuals and they work like 24/7. The patients are allowed to call anytime in this country. So my suggestion to all my brothers and sisters in medicine is that they should not work as individuals. We should work as teams. There are 2, 3, 4 people. Whenever we can join together, share the emergency hours, share the duty hours, so that you have enough time to relax. So that is important, which our country has not adopted so far. Coming to myself, I have a team of almost 12, 13 people. So our work gets divided. So everybody doesn't have to be present every time. So that gives you a lot of relief. Coming to the physical component of my duties, yes, you are right that some of our procedures can be very long. For example, we have to work in the cath lab. One procedure may take 4 hours or 5 hours. So the only way to keep yourself fit for these kind of procedures is that you have to be physically and mentally tough person. So for physical toughness, you have to do 2 things. One is some regular exercise, and I have found that there is nothing better than yoga. For example, we have to see at the X-ray when we do the work in the cath lab, and I have to bend my knee to see on the scope on one side, ECG on the other side. So I have to move my neck. So I can do that because I do yoga. Otherwise, it can be very, very challenging. The second thing which I do is that a day before we assess the complexity of the case, we'll keep one case complex in the morning, other cases less complex. Don't keep complex cases on the same day. Another thing which I do, and my colleagues do, is that if a procedure is, I'm doing 2 hours into the procedure, then I will call my colleague to take over for some time. I'll go out and have a breather, have a cup of tea, and come back again. Because some of we do, ablation of arrhythmias, and some of these procedures can take 3, 4, 5 hours also. So that is how one can deal with these situations. That is how I do myself, and I think that is pretty good and very effective.
Thank you, Dr. Kler. Dr. Harish, what self-care strategies do you employ to maintain your own mental well-being and prevent a burnout in a field that can be emotionally demanding?
I write poetry, I write prose. I travel to my hometown, Mangalore, every 6 weeks for approximately 4 to 5 days. I wander aimlessly on the streets, sometimes meeting friends. Meeting school friends is one of the most heartwarming strategies. But among psychiatrists also, we have colleagues with whom we have night out, what you call as coffee jumping, not bar jumping, but coffee jumping. And these things work. But all the same, what is important? What is the goal of your life? What is the purpose of your life? Do you want to go from 1 bedroom to 2 bedroom, 2 bedroom to 3 bedroom, 3 bedroom to 4 bedroom, then a bungalow? But what is it that you're doing? And I think the philosophy of life defines where you stand. Are you comfortable if you don't have the car which your neighbor has? Are you comfortable if you don't have enough likes on the Facebook as your neighbor has? So I think the philosophy of life, of understanding that we are all mortal and our journey is finite and not infinite, makes you understand that you have to really dwell minute by minute, live in the moment as much as you can, and not bother about what happened in the past, and not really look ahead and worry about it. So philosophically, psychiatry is a very humbling profession. And you'll find psychiatrists dressed in simple clothes, even in conferences, unlike cardiologists and unlike neurologists. So since psychiatry is also a humbling profession, there's a lot of philosophical exchange, there's a lot of music happening between us, there's a lot of plays, dramas happening. And I, for myself, poetry is one of the most beautiful ways of relaxing, and sometimes being alone, being quiet. I walk on the beach before COVID. Now I've not gone after COVID. Once in 10 days alone in the evening after finishing my work, and just smelling the sea and feeling the sea. I think small joys small joys, little friends, nature helps me to remain balanced. But again, I'm saying I have bad days. They're very less, and I have a lot of good days.
Dr. Harish, you actually make us remember the words that,
We can do a poetry on bad days and good days.
Look forward to the poem on bad days and good days. And I really like the part where you said that.
I'll write that tonight.
Yeah, thank you.
Share it with us.
I will, Duru.
Yeah.
Thank you so much, Dr. Harish, and thank you so much, Dr. Gilada and Dr. Shah. Dr. Duru Shah, how do you as a gynecologist manage the emotional and psychological impact of dealing with sensitive and potentially traumatic situations related to women's reproductive health?
That's exactly what I told you, that, every woman who comes to me with where I feel very distressed about something, that I need to do something, I set about doing it. And recently, when I'm dealing with infertility patients, I realized that there was a lot of problems which women were having, and especially women who are working women into careers. They want to get pregnant, but they because of careers they do not want to get pregnant. At the same time, it's a mixed bag. They reach the top of their careers around 35 to 40. And that's the time, it's getting late to have a baby. So they were struggling. And I felt that, if they give up work, then they lose money, they lose their jobs, and then they can't come back again. At the same time, rural women have a big problem. They're losing a lot of land and jewelry. They sell off just to get pregnant. So in short, I took a whole document to the Government of India as a president of the Indian Society of Reproduction, and I met a very nice gentleman there who was in charge of the Ayushman Bharat scheme, and I put forward all these issues to him. He gave me a great hearing for almost an hour, and he said, I'll do whatever I can. What I told him is, let's get it covered by health insurance. Health insurance doesn't cover infertility. So in short, I put it to him, and within 2 months, infertility got covered by the health insurance scheme. Before that, I started talking to all the health insurance companies. None of them were willing. None of them, they said nobody's interested. So when the thing went from the whip went from the government, the insurance companies started insuring infertility as one of the health conditions, because WHO describes this as a disease. Infertility is described as a disease, and it needs to be covered by health insurance. And day before yesterday, I was very happy to read in the news that the multinationals today are offering 10 lakh policy on infertility to all their high-level women executives whom they don't want to lose, so they are covering their treatment. And that is what gives me the pleasure, that whatever I've worked for, if it culminates into something which is going to affect millions of women all over the country, that's what helps me. So this is what I do, where when something bothers me, I take it up. And there's another such incident where we found that rural women were dying of hemorrhage during pregnancy and labor. Reason being, their hemoglobins were very low when they went into labor. They didn't take the iron tablets which the government gave them, because they found it too many side effects. And the women whom we gave foils with, the regular tablets we buy from outside, they would take it. So I approached the government, why don't you start the intravenous iron therapy, which we are giving to our private patients? Why don't you give it to them? They said, well, there's no proof, no evidence. We don't know what damage it can cause, what side effects. We can't afford to have a woman dying, a child dying, a fetus dying. So I put the Public Health Foundation of India. We did a 4-year study in the rural parts of Bihar and wherever mortality was high. And we did a study which showed that intravenous iron is pretty safe, no problem. Published it in the Lancet, and then asked the government to take it up. And today it's part of the rural health program. All women who go, it's a compulsory for pregnant women in the rural areas to go for at least 4 antenatal visits. So during the antenatal visits, they get their intravenous. This has definitely brought down the maternal mortality in the country. Otherwise, we were losing 400 women to every 100,000 women who had a live birth. Now we lose less than 100 women with 100,000 live births. So it has made a huge difference. So that's what I like doing.
Truly inspirational to see how the patient's personal, physical, and mental trauma, when it was presented to you, you managed to take it and go all the way to ensure that no one in the country has to suffer. Truly, ma'am, hats off to you. Thank you so much, Dr. Duru, for sharing that with us. Hopefully, we'll have a lot more of actionable inputs coming because of your work. Thank you so much, Dr. Duru. Dr. Gilada, while there are myths related to infections, there are also definite risks associated with the infectious diseases. So how do you take precautions, and what advice do you give doctors when it comes to precautions for infectious diseases to protect their own health?
See, we tell doctors, and we do ourselves also, telling people that we are lambe race ke ghode. We don't want to be exhausted in just 1 or 2 cases. We don't want to risk ourselves when we understand the consequences of that infection. However, if you look at what kind of support system is available, colleague to colleague is a free treatment. No doctors charges. In India, it is unwritten law or ethics that doctors do not charge other doctors for consultation. But you go to hospitals, most of the hospitals are run by business people. In the same hospital where we are working, we do not get anything free except the medical consultation. Everything is charged to us. And in the same hospital, a millionaire comes with a below poverty line card and he is treated free or she is treated free. So this kind of dichotomy there in this country. There is nothing free for medical doctors. We have to have our own insurance. So we have to tell doctors that we have to take care of ourselves. We should be insured properly. We should have also liability insurance, because sometimes people with somebody's instigation sue us. So we should have that kind of precautions to be taken. And we should be very particular when we are discharging our duty. As Dr. Kler said, that we are not scared of somebody coming and beating us, because we maintain a good public patient-doctor relationship. The always open channel of communication. Anybody can come in and talk. So that way we are very much open. And then therefore, if something happens, fine, that is part of the professional risk. But by and large, we do not commit anything by which we invite any kind of assault from somebody.
Thank you, Dr. Gilada. You really did bring out an interesting point about the scope of insurance when it comes to doctors, not just for their medical health, but also in terms of legal help. So thank you so much, Dr. Gilada. Dr. Kler, how do you balance the demands of professions with maintaining a healthy work-life balance, considering the high-pressure nature of your work?
Okay, so this is, I think, a very, very important aspect of a doctor's life. We really, all of us need to learn how to balance professional versus the our personal life. So first of all, I told you before that I am very passionate about exercise. I do cycling. Last year was my 69th birthday, and I cycled 69 kilometers that day to give myself that gift. And this year I will do 70. Then I love mountains, I love flowing rivers, and I love trees. So every 3 months I have to go to mountain somewhere, either in Kashmir or Himachal or in Uttarakhand. I am going in August to Valley of Flowers and Himkund Sahib. So I have done Kailash Mansarovar Yatra on foot. I have done Amarnath, and I have visited almost all the major shrines in the world except Makkah Medina, which I want to do, but I'm not allowed to do. So I enjoy my life, and I think our psychiatrist friend Harish, he said many good things. And if you have good friends, very good friends, 2, 3, 4, where you can speak your heart out, sit with them, that gives you a lot of relaxation. Friends and family is very, very important. And I tell my juniors, the junior doctors who join me, I tell them the time to enjoy is today, not future. Don't think that you will get rich one day and then you will start flying a business class and then you will enjoy. No, enjoyment doesn't depend upon money. It doesn't depend upon the place. It doesn't depend on anything. It's an attitude, mental attitude in life. So if you are enjoying on cycle, now I enjoy on a car. If you have money, you can fly to other country. But basically, fundamental thing is that the purpose of life is to contribute to the society, contribute to your family, and above all, make yourself happy. My yardstick of success is only one, that how much satisfied and how much happiness you have inside your mind. Only you can tell that, nobody else can tell. Nothing else matters in life.
Thank you so much, Dr. Kler. It's a joy to know about how youthful you are and how you continue to inspire ones who are much younger than you. So thank you so much, Dr. Kler. Dr. Harish Shetty, back to you. What support systems are available for psychiatrists to safeguard their mental health well-being and maintain their own psychological resilience?
Well, psychiatrists accept that if they get depressed, they need to take medications and counseling. So a lot of mental health professionals seek help on their own. And that's the beauty, because they believe they're mortals, they believe they're finite, and they believe that human beings. Number two, there are informal support groups. In the sense, young psychiatrists have their own support groups from the batch. And formal support groups are very few. But informal support groups are there among private practitioners. In institutes, there are formal support groups where people sit down at the end of the day or once a week and share how they feel about their work, share how they feel about their life. And like sadhakas, they share their emotions with each other. Men who are psychiatrists share emotions with each other. And that's also because they deal with emotions all their lives. But I would yet say that because of the paucity of time, 9,000 psychiatrists with 20 crore patients, most of us, like what Anurag said beautifully, is that friends from outside the profession and outside the view, the not the inside view, help psychiatrists to probably remain in their own sanity. But we also flip, we also get angry sometimes, also get rude, also once in a while. But the awareness that you are angry, the awareness that you're rude, the awareness that you flip is something which we all really enjoy. But each psychiatrist has something, some mood lifter or mood shifter he or she has learned across time, which he or she can use. It's unique to that person. You cannot generalize for everybody. But I tell each one of us that we have the gift of yoga, we have the gift of vipassana, and a million other traditional indigenous methods to relax. We should use it without shame, with pride, and with an open heart.
Thank you, Dr. Harish. Let's look into what are the indigenous systems that we have existing already into improving our physical and mental health. That's a fantastic thought. Thank you so much, Dr. Harish. Dr. Duru, what strategies do you employ to maintain a healthy work-life balance? We can understand that you not just look after patients, but go all the way into policy. So if you could help us understand, how do you have a work-life balance?
I think right from day one of my practice, I did not work on weekends. I decided not to see patients, and that was the weekends devoted totally to my family and my children. They were young. And as they grew, I think it was a inbuilt system into them, that like say they would ask me, Mom, why do we have to study? Why do we have to be educated? Why weren't we born educated? Stuff like that. And I kept telling them no, because my agenda was empowering girls so that they can stand up for themselves. And I kept telling them, no, you have to study because you have to earn your own bread. You don't have to ask anyone for anything. You do not need to ask anyone for money for buying your sari, because I wear saris. So they tease me today that, Mom, I don't wear saris, what will I buy with what I want? So in short, women's empowerment has been my agenda, and my girls were my pride. And even today, when there are women coming and asking, that I want to have a boy, I say it's illegal, you can't even think about it. But why don't you educate your girls? Why don't you make them empowered, etc., etc.? And I've been able to motivate some parents to send their very, very, these women who are very, very orthodox and don't want to send their young girls for universities abroad, etc. I've been able to convince them to send them. So work-life balance has been work Monday to Friday for sure. Saturday, Sunday, family completely. No practice. At the same time, this is right from day one, when I was still traveling by bus. I didn't have the money to have a car. I traveled by bus, but at the same time, I did not work for money. I was enjoying my work. That was the thing. I have a team of doctors now working with me, and so they take all the calls. given them phones from the clinic. Whoever patient calls, they are talking to them, and emergency calls are taken care of. I hardly have to get up in the night now, and things are much, much easier with the team of doctors with whom I work. And I think that's how I've maintained it. And family is great. Living abroad, most of my family, so at least 2 trips abroad to meet family. Weekends with the girls, even till today when my girls are in town. Sunday lunch is fixed for them. There's nothing else I do on Sunday. I will never accept a lecture, never go for a meeting, never do anything. If my girls are in town, we have lunch together. So it's been like that since they were kids. So we still follow that tradition, and I think I'm very happy about it that I'm able to balance my life. And those days when we didn't even have mobile phones, as a matter of fact, my girls felt very proud. I'll tell you one very nice incident. I was in the club. No mobile phone those days. We had only pagers. And there was one patient desperately trying to get through to an hospital, that the patient has come in labor. And I used to leave the messages at home where I am. So my 9-year-old daughter takes the phone and she takes the call, and they say, we need to get hold of Dr. Shah urgently. So she rings up the club and she says, please call doctor on the phone. They said, sorry, we can't. 2-3 calls just went apart. Finally, she told them, this is a matter of life and death. You please call my mother on the phone. And I got onto the phone, attended to the patient. So what I'm saying is, we build those things within our children so that they understand and they respect doctors even today. So they understand what their parents have gone through, what they do, and they respect. I think our children learn to become more independent when we are not at home nagging or doing their homework or teaching them something or coaching them. They get more independent, they are more empowered, and I think they understand and value what we do. So that's how I have balanced work and family.
And with your words, may all doctors get inspired to keep the weekends sacrosanct so that they do focus on self-love and self-care as well. So thank you so much, Dr. Duru. Thank you, Dr. Anurag. To be honest, this discussion has been the one where I've had goosebumps. But unfortunately, because of the paucity of time, we have to come to a conclusion. So staying on for the discussion on staying healthy while healing others, challenges of a doctor. On behalf of timesofIndia.com, I thank Dr. Ishwar Gilada, Dr. Kler, Dr. Harish Shetty, Dr. Duru and Dr. Anurag Aggarwal. Thank you so much. It's been an absolute delight to hear from you, especially the pearls of wisdom, insights, and the strategies that you adopt. Thank you, and happy Doctors' Day.